If you don't have insurance, going to the dentist can come with a high price tag. The average cost for a visit can be hundreds of dollars, and depending on the work you need done, can cost over $1,000, which is why a group is working to lessen the burden this weekend in the Triad. We are joined by the NC Dental Society and pediatric dentist in Burlington, and she's one of the lead organizers at the upcoming clinic in High Point, offering free same-day care to hundreds of North Carolinians. So can you explain more about the clinic and what services will be offered?
Yes, this clinic is being sponsored by the North Carolina Dental Society Foundation, and our targeted audience is actually adults. I know you mentioned pediatrics, but we treat adult patients only. It will be held on Friday and Saturday of this week, that's March 28th and 29th, at Williams Memorial CME Church on 3400 Triangle Lake Drive. And at this clinic, we provide services such as exams, x-rays, cleanings, extractions, and this year we're very privileged to have an endodontist who's going to be doing some endodontics or root canals on Friday morning early. So we do a lot of services that can be obtained from a general dentist free of charge.
Absolutely. Talk about the overall purpose and the importance of this clinic and why people should attend if they can.
Yes, this is an opportunity to have services provided if you don't have a dental home or you've been in need of dental services for quite a while and you weren't able to afford them. We have dentists who come together, dentists, hygienists, dental assistants, and a number of community volunteers to put this clinic together to provide these services free of charge. Now, these services are on a first come, first served basis. So patients start to line up long before the clinic actually opens, and we open at 6 o'clock on both days. And the first day we'll go from 6 till about 4, and on the second day we'll go to 6 till about 3. But if you're in line and you've been triaged, we'll see you.
Okay. Well, I know the clinic has been going on since 2003. We spoke about this a little earlier.
Yes.
How many people have you guys seen in total since 2003?
Well, these clinics have been held throughout the state of North Carolina. This is one of our bigger clinics, and these clinics serve during a 2-day period anywhere up to 600 people. Since 2003, we probably served about 81,000 or more people, and this translates into about 38 million, 39 million services free of charge that we have provided across the state.
So take us through the process. As soon as I'm an adult and I want to come to a clinic, walk me through the process of what happens when I get there.
Okay. Well, first of all, you arrive early with a positive attitude and a lot of patience. And we have dentists who are designated triage dentists, and they will review your medical history with you and see what service you are in most dire need of. And that's what we'll try to address on that day. We're only able to provide one service. So if you need a cleaning, we'll do a cleaning. If you need an extraction, we'll do an extraction. If you need a filling, we'll do a filling. So we'll do what you are in most dire need of having done.
Absolutely. You know, what specific challenges do North Carolinians face when it comes to accessing dental care, and how does a clinic like this help combat those challenges?
Well, as you mentioned earlier, so many of our citizens do not have private dental insurance. A lot of our citizens have or recently became eligible for North Carolina Medicaid, but there is a lack of access of providers because of the reimbursement rates associated with the Medicaid program. So a lot of these people who need treatment are not able to afford care in a private practice setting, and they're not able to identify providers because there's a shortage of providers who actually provide this care at a lower or discounted cost. So it's a challenge for a lot of patients to find providers, and it's a challenge for dentists to provide services at a low reimbursement rate. So it's a combination of things. So a clinic like this is especially beneficial for people who aren't able to access dental care, who don't have private insurance, or aren't able to find a provider that suits their needs. So this is an opportunity to get this work done, or at least get emergency type services done to keep you out of an emergency room on a day of the clinic. So it's good if you don't have access otherwise. If you have pain, you can come in and be treated.
Absolutely. Well, thank you so much for telling us about this. And I'm going to pull the flyer up one more time so folks can see. Free dental health offered at Williams Memorial CME Church in High Point Friday and Saturday. Doors will open at 6 in the morning.